Many thanks for being there. And the program is still Good Morning Abuja, coming to you only on the Unity Station NTA Channel 5. We have another guest with us in the studio, and this time we want to talk about our health. We know we are celebrating our children, but we really want to be mindful about our health. This morning, we want to talk about advancing awareness and management of cancer from the radiotherapist perspective. And this morning, we have a radiotherapist with us to talk to us more on that. Help us welcome Umi Musa Umar. Umi, you're welcome to the program.
You're
Thank you
welcome.
for having me.
Thank you
Thank
so
you,
much
ma'am.
for joining us.
Thank you for having me.
Okay.
Okay, let's start. When people hear radiotherapy, they begin to
Radiotherapy.
wonder, what is it all about? Who is a radiotherapist?
Okay. So, a radiotherapist is part of the multidisciplinary team that handles cancer treatment.
Okay.
The team that consists of the doctor, who is an oncologist,
Okay.
then a radiotherapist, who is the person that operates the machine we call a linear accelerator,
Okay.
uses that machine to treat cancer. What we do is we use radiation, we dispense radiation through that machine to target tumors and cancer cells and kill them. That is what we do. So we have more members in the team, and of course, each member has their rules. And a radiotherapist's role is critical because the whole point of having a team is to kill cancer and to cure that disease. And of course, a high percentage of cancers need radiotherapy as a major part of the treatment.
Wow.
So that's what we do.
Okay.
Okay. Yes, having taken us through what radiotherapist is all about, now let's talk to us more about some of the common misconceptions about radiotherapists when it comes to cancer detection and management.
Okay. Like my field is centered around radiology and radiotherapy. There's one thing common in those two things, the radio, which a lot of people think
As the
is,
name
yes,
implies.
think is the media radio, but it's
Oh.
not. Radio was gotten from radiation.
Radiation.
Yes, which is the phenomena that of radiation, radioactivity. So radioactivity has a lot of usage in the human realm, and one of the things is through health.
Okay.
And one way that we use radiation for health is through diagnosis or treatment. Radiology department deals with diagnosis, where you have your X-ray, your CT scanners, your MRI scanners, and a lot of other machines that they use to diagnose different diseases. Then when you come to treatment, that's radiotherapy. It only deals with treating cancer. Even though we use it to kill other tumors that are not cancerous, to tackle them, but basically it's for treating cancer. So both of them use radiation, and the highest misconception gotten is when people hear of radiotherapy, radio this, is that we are radio or we are related to media.
You're on air talking.
We're on air talking.
Okay.
It's not like that. And another thing is people calling us doctors. 50 years back, it is very hard for you to see a radiotherapist in Nigeria. When you talk about 20 years back, even now, we are hot cakes because we are not much in the country. We're still, it's still, there's no awareness about that your child doesn't have to be a doctor to treat diseases.
Okay.
Well, so when people call me doctor, I quickly jump in and say, no, we need our name to be known too. I can continue my specialty and be a doctor of radiotherapy, but that doesn't make me a medical doctor. We have different rules.
Oh, okay.
And it's good for people to understand so that when you go to the hospital and they tell you, go there and see that radiotherapist, you won't go asking of the cancer doctor because that's an oncologist, not a
Okay.
radiotherapist.
Whoever works in a hospital,
Is
there's this general
yes,
doctor.
either you're a doctor or you're a nurse. Okay, so
Yeah.
let's look at the advancement of technology. For instance, the AI and the machine learning now, the impact of it on this radiotherapy in cancer
In
detection.
cancer detection. Well, of course, AI is going into everything now.
Everything,
And
yes.
we're even scared AI is going to take our job. Because, for example, in radiotherapy, let me start by that. there is an AI software that once when it was introduced to us, actually some people from abroad, we had a video, we had a webinar, and they were explaining to us how and trying to introduce it to our institution. They were just going to take a CT scan, show them the tumor, and they will plan the radiotherapy, do everything, and send it back, and the patient is ready for treatment.
Wow.
On a normal day, when we scan, we send it the doctor contours, the medical physicist, part of the team, they do their own planning. It takes some days to finish, but this is something they can do when we send to them in 30 minutes.
Wow.
They will use the advanced AI technology, plan everything, and just send it back. And the patient can be seen that particular day. Even when we do it manually, there are emergencies when we have to rush. Everyone has to come up and, we have to do this today. But on a normal day, it takes days because it takes different units in the oncology and radiotherapy department. So AI doesn't leave any stone unturned right now, yes, in this era. And also when it comes to diagnosis of cancer, recently I got an email from University of Aberdeen in the UK. They introduced a certain AI software that they use for mammography.
Okay.
Mammography is the breast screening
Yes.
that women do every year. And that particular software, the AI software, does not, the efficacy and the specificity is so high that no lesion, no matter how tiny, can be missed.
You can detect.
On a normal day,
Wow,
yes.
that's a
On a
good
normal
one.
day, you can do an MRI, and if the lesion is so tiny, it can be missed.
Mm.
And if we see something suspicious, we can ask the patient, come back in 6 months. By the time it's
Fully grown.
good enough, yes, that we can now see it. Or we give, okay, come back in 3 months, let's check again. They don't need to do that, no matter how tiny AI detects it. So I think AI is very much welcome
Wow.
because it advances everything and
I
it makes
think
our job
honestly,
easier.
no wonder, make your job easier.
Easier.
Don't be scared that it will take
Take over.
over.
No, it will not take
Yeah.
over.
And especially in cancer treatment, time is of the essence.
Yes.
Because there was this woman that we were talking to, and she said that she did a mammogram, and after 6 months, she was feeling uncomfortable, and she went and had her breast checked, and she was asked to do another one. Within that 6 months, she was told that a lesion had developed, and if she had added another 6 months before coming, it would have advanced beyond beyond cure, because it is an aggressive kind of breast tumor. So you see, in the advanced world, it is really making waves and advancing their healthcare system. And I think with time, we're also getting there.
Okay, that leads me to the challenges as a radiotherapist. What are the challenges you have in cancer detection?
Okay.
You have just mentioned one.
Yes.
Okay,
yes.
so let's see more or hear more.
Infrastructure. That is the one I mentioned. And I think if I'm to elaborate on it, I'd say from diagnosis to treatment, there is a dearth of facilities and the machines that we need to work. Because no matter how much we want to work, we have been trained, but we need what we use to work.
You need the tools.
As a radiotherapist, I cannot function without a linear accelerator. I know centers that have radiotherapists that have been trained, but they have been out of work for over a year. They are just there waiting, and there's no date for when machine will be installed there. They had a machine before, it broke down, so they have been just there. You understand? So we need those machines. Without them, we cannot do much. And also, as an advocate, I go on social media, I go into communities, and I tell people, you need to screen. You need to have timely screening. Cancer, you don't wait for it to happen.
Yeah.
Once you wait for cancer to show itself, by the time it shows symptoms, then it's most likely advanced. So before that time, you'll be checking by yourself, and when you catch it early, it gets treated, and there is a hope that the prognosis will be excellent. But then, I am able to, as an advocate, convince you to go for your yearly mammogram. Then you ask me, where can I get it done? And then I have no answer for you. Because, for example, last year in October, I was I liaised with a hospital. We got in Abuja. We got a 40% discount on mammograms and breast ultrasounds, free registration. So it was almost like a woof. So I was trying to mobilize women to come. Women that were not in Abuja, I was online directing them. You're in which state? Okay, this is the closest machine to you. Go have it done. A lot of states, I had a lot of challenges because I cannot tell a woman that lives in Nasarawa that you have to travel to Abuja
Abuja to get
for
yours
just a
done.
preventive measure. You are fine, but just to check, you have to travel. I think the government has to come in on this. This present administration is doing a lot. We are hopeful.
Okay.
We are
hopeful indeed.
Yeah.
Okay,
We are.
yes, as an advocate, I want you to talk to us more on the management of the victims because, like I said earlier on, there's this misconception about cancer patients. Once you're diagnosed of cancer, the support that people out there will give to you is minus what? So, talk to us about the management and the support mechanism that should be given to them.
So that's one of the major things that we advocate, patient education and also navigation. Because I think that's one of the things that is not given due consideration. That yes, and attention, that navigation. Because as an experienced worker that have worked in Abuja for a long time now, if you have never been to a national hospital and they just dropped you at the gate and say find your way, it's going to be very challenging, even for us. So talk more of someone, an indigent patient coming from their village, far in southwest or in the northeast to Nigeria because they don't have the facilities and they are referred here for better care and they just come in. They don't know where to start from. It is quite hard. But first of all, we have to start from how educating people on how to receive that kind of information and then acceptance by the patient. You know that it's not my portion mentality. The patients themselves say it's not my portion. They go to their mosques or churches and just they pray, and before you know it, there are herbal concoctions everywhere. Okay, this is not, no, it's wrong. It's the devil. We have to accept. We have to accept.
Looking for the devil where the devil is not.
Cancer is a disease. It's not the devil. Cancer is a disease, and when left untreated, it advances. Mostly, what gives rise to a very high mortality rate, the rate of people dying from cancer, which is very high. We have one of the highest for breast cancer in Nigeria, in the whole world. Why?
Wow.
Because they present late.
So, want you just in one sentence, what would you want to advise as a radiotherapist? What would you want to advise to?
Okay, what I want to advise everyone, women and men, is for you to know that there are cancers out there that are ravaging the society, killing people every day, especially breast, cervical, and prostate cancer. So the men would not say it's a woman thing. Go for screening. Early detection is key. All these cancers have screening ways that they can be seen early, and then treatment the prognosis will be excellent. So please go for screening.
Thank you so much. Thank you.
Thank you,
Early
ma'am.
detection is just it. Don't just wait there. And remember, it's not your village people who
Yeah.
that is possible.
And don't say it's not my portion.
Don't say it's not my portion. Don't even say it's the devil because the devil is nowhere there. So it's good for you to go to the hospital. Thank you so much.
Thank
In
you.
fact, as we were talking, see the way we're just, we're feeling it because like when you talk about money, you talk about people who have it, they want to be treated, but there's no finances for them to do that. And then the government need to up their games, honestly, need to, so that we can have the machines, the tools they need to work as a radiotherapist to do the work. We've been talking about cancer treatment, okay? Now the program is still Good Morning Abuja. Please don't go anywhere. We'll be right back.